You understand that it's time to talk health. Mm. There's a name that is coming to my. Well, I'm not a doctor though. I am. I'm a broadcaster. But Dr. Adiogun will help us speak those big grammar. Mm. Good to have you join us in the studio again.
Good morning.
Good morning. Good morning. Welcome.
Thank you.
Everyone, feel free to join the conversation. All right. Doctor is here. I would always bring him here to help us understand some of these things. You know, a lot of us who will just stay back at home, fold your arms when something is happening. You feel it will just go by itself and all of that. Please get the right information and do the right thing. Okay, that's what I would say to you at this time. But if you've been following if you've been following me, there is something I would always do. I'm talking to everyone now. I have been mentioning some major issues, some major health issues, faced by Nigerians. If you've been following me, all right, and I'm not done yet. I'm not done yet. I might be asking a question on your behalf. Okay, and I would beg everyone to is wealth. The business of health is a very important business. You don't just bring in anyhow people to come and talk health because we wouldn't want to put the people's lives in.
Well, malaria is a disease that is very predominant in Africa and in the sub-African, West African sub-region. So basically, it's transmitted by the bite of the female mosquito, the Anopheles mosquito. So it introduces the disease-causing organism into the blood, and then the parasite has its life cycle in the liver and in the red blood cells. So eventually, it's a complicated developmental process of the parasite, and basically it produces the symptoms that we know classically as malaria symptoms. They are beginning to protect themselves against what you have. So you need to find newer drugs, that will be effective in treating malaria. Otherwise, when you have drug resistance and you're beginning to have resistance to treatment,
Okay.
then it now becomes a problem to manage malaria. And mind you, we also have an aging population. People who are elderly, when they have malaria, it's also a big deal to them because it really, takes a big toll on them. So malaria prevention is key. Let's find a way to prevent it in the first instance, and then we can now talk of treatment. So keeping your environment clean, mosquito, insecticide-treated nets, and making sure that stagnant water and drainages around you are, well taken care
Now, so some people will tell you to always treat malaria every month. So we'll tell you 2 months, every 2 months. Some will say 3 months. Some will tell you I treat malaria twice a year, 3 times a year, 5 times a year, and all of that. Which one is better? Which one would you advise people to do?
of. Well, malaria treatment is not written in stone that you have to treat it three
No,
months.
like for instance, whether you're feeling anything or not,
Not that you just want to
just
prevent
go
malaria.
and use this thing.
No, you don't
Do you
just
know?
abuse medications like that. The truth of the matter is that if you are living in the tropics, like in Africa, for instance, malaria has always been with us. So it's not really a big deal to most Africans because it's something that is common. But basically, people that we encourage to go for the periodic malaria prevention measures are people who have peculiar situations. Like, for instance, you're a foreigner in Africa. You've not,
Okay.
yeah, you're a foreigner in Africa. Maybe you came for a vacation or a program or a course. You would have started your preventive medication before you come to Africa. While you're here, you're going to stay on it all through, and you will still continue it for some weeks after you return back to your destination because you are not used to this environment. All right. So for foreigners, it is advised that they take the preventive malaria medications. For sickle cell patients, we also advise that they do so because they are exposed to mosquito bites, but we know malaria is a trigger for their crisis. So we don't want them to have malaria. So one of the things we do is, apart from advising them sleep under mosquito
So
nets, we
sickle
also
cell
give
should
them
avoid
malaria.
malaria.
Malaria is a trigger for a crisis.
Ah.
Malaria, infections, dehydration, being in a cold environment, not managing stress properly, all those are stressors for them, and then you can see to deal with. So definitely in pregnancy, you also give them malaria preventive medication. Then in people that have um, immunocompromised states. Either maybe they are HIV positive, or they have something that has really, really reduced their immunity, or they have some immune deficiency status. It is very necessary that they are on malaria preventive medications, because they are already down, and malaria will take them lower than what they are, and it can completely knock them out. So you also want those people to also be on those. Then you also have people that have some kidney problems like nephrotic syndrome. You also want to prevent malaria in those people. So those are the main classes of people that I believe should have frequent preventive medications for malaria. But for the general population, all you need to do is just make sure your environment is clean, reduce your exposure to mosquito bites, and make sure that when you have malaria symptoms, don't just assume it's malaria, because sometimes Lagos stress can feel like malaria sometimes.
Okay.
The essence of going to a hospital, having a doctor check you out, running the right the disease of the heart muscle itself, and then you can have myocarditis, which is inflammation of the inner wall of the heart, and all those can, cause major complications that are life-threatening. A lot of people, have heart conditions because it sometimes runs in families too, but they don't know.
Okay.
They don't know. Just like high blood pressure can have a familial predisposition, because if your parents if one or both of them have high blood pressure, the tendency is that the kids may also have high blood pressure. If you have any first degree relation, it's possible, you can also have that kind of ailment that they also suffer from, because you share the same genetic material, you are from the same lineage. So it's very essential that everybody goes for regular health checks. Sometimes the first indicator of a heart condition is a simple chest pain. And I was doing some lifting, that's why my chest is pain. So many assumptions. It may not necessarily be a. And these little tiny arteries, the coronary arteries, that supply the heart, may get clogged up either by cholesterol or blood clots. And when this happens, a part of the heart muscle will not get enough perfusion. It won't get enough oxygen. It won't get enough blood supply to continue its function. And then you now start having what we call ischemia. That's shortage of blood, shortage of circulation to that area, and part of that heart muscle may die out. And then you now find out that the pumping blood is the ejection fraction what it's supposed to be. Is the contractility of the heart adequate? If those things are not adequate, then your cardiologist will tell you what to do. There are medications that they will give you to improve your quality of life. So people, in other climes that have access to good quality health care and good emergency response, they live longer. Not because they don't have these diseases, but because systems are in place to make sure that they can get the help they need when it is required. So it's very necessary that we go for
There's
health
this
checks.
instance you hear people say, I just had a slight pain in my chest, What happens in that situation? It just like, I just felt something, just slight pain, like in my chest.
And it went away shortly after.
Yeah.
Yeah, so it could be something cardiac. It could also be a simple heartburn. When you have acid reflux, there's this burning sensation in your chest. You feel this pain in the center of your chest is so discomforting, and well, that is a digestive symptom, because so assume by yourself that is nothing, whereas it's actually an emergency. And our emergency response is not what it should. High blood pressure. We want to divide the causes and the risk factors. What are the causes? The cause is unknown. Nobody really can say this is what is causing high blood pressure. But in 90% of cases, we don't know the cause. But in 10% of cases, maybe a person has kidney problems, has some hormonal problems, some thyroid issues, and some other hormonal imbalances, or pregnancy-induced hypertension. All those can happen on the side. But for most cases, the causes are not identified. So for the risk factors, what are the things that put you at risk? They are divided into two. You can't change them. Then we have the modifiable factors. So the modifiable factors are the ones we should focus on that we can change. The ones we can't change: age. You get older, your risk increases. You can't do anything about your age. The family you are born into, you didn't choose the family you are born into. So they have a line of hypertension. There's nothing you can do about it. Then you also have your gender. For men, they have a higher risk than women, but women, when they reach menopause too, they also have and increased risk of having it. So basically, you can't do anything about gender, age, and family. But for the ones you can do something about, the bigger you are in terms of your size, your body weight, the higher your risk. Oil everywhere, eating a lot of red meat, all those things can encourage the bad kind of fats. So when people now come down with high blood pressure, the first thing in Nigeria is they will tell you, my blood pressure is not always this high. I don't know, maybe there's something wrong with your machine. They will even blame the machine and say that they know that they are. And it is only a matter of time before it rears up its ugly head. And unfortunately, something like high blood pressure, when it comes full force, it may come in form of a stroke, may come in form of sudden death, may come in form of kidney problems, kidney failure, may come in form of eye problems.
So it can lead to so many things.
So many things. So a lot of people sometimes, the first time they ever knew they were hypertensive, especially people that don't go to the hospital and don't go for checks, is when they have a stroke. You just notice suddenly, that's you on a drug, tells you to come back at the end of the month, you don't show up, and you stop the drug by yourself. That's the disaster waiting to happen. So it's best to always make sure you follow up your appointments, your hospital appointments, you stick to your prescriptions. If they ask you to lose weight, please lose weight. It may be difficult, but little baby steps, they all add up. Try to lose weight. Start your portion control. Start reducing the carbs in your food. Start your regular exercises. If you need to see a dietitian to draw up a meal plan for you that is suitable and appropriate for you, they will do so. And you stick to it. And don't cheat. Because you see some people, they're on a meal plan, they know what they're supposed to be eating, but they'll say, just once in a while now, I just decided to go and take the burger or to go and eat something. And then you just eat something and you complicate issues for yourself again. So it's very necessary that you go for your health checks. And it's always important that once you have high BP, know that it's something that is a long-term treatment. It's not treating.
So long term, you just keep treating.
Just cross your mind that is something you will continue to monitor from his own family. So you know that you're on your own, really.
This hypertension you mentioned, some would say like this normal balance, this normal thoughts, this normal belief that thinking now they cause hypertension. He too think now hypertension kill him. I tell him making no they think.
Is there anybody that doesn't think?
What do you think?
Is there anybody that doesn't think? We all think now. So it's not when you say thinking, what they typically call thinking, okay, maybe a person is anxious, worried.
Maybe that's it. Is it true?
And all that. Well, to an extent, stress, if you poorly manage your stress, yes, you can increase your chances of that. But that is not the only singular thing. Other risk factors that I've mentioned to play a role. So there are a lot of people that are stressed out. There are a lot of people that, in fact, their routine is so hectic and their BP is still normal. They are worried about money. They are worried about rent.
Everything.
That are the weight-bearing parts of your body. Carrying that kind of weight becomes a problem. There is more wear and tear. And before you actually get old, you are already looking like an old person. You're already limping, needing to use a walking stick and all that.
Because of time, I might not be able to go into what's it called now? Some other illnesses I would love to mention. But just one thing I want to ask you. The difference between drugs, or drug production by different companies. Some will tell you, no, this particular company use this drug. Is it that how far, and they will tell you, okay, it's just a brand name. Please tell us about it. I don't understand.
Yes, the truth is, there are different pharmaceutical companies from different countries, and the truth is, different companies, put priority on the quality of what they produce. And when you talk about quality, you also talk about the research that has gone into production of that particular medication. So, some pharmaceutical companies are constantly doing research. They have statistics, they have data.
Yeah, 24 hours Medicare is where you can get the doctor. 24 hours Medicare. So many questions here, but hey, I would have doctor here on next week, Thursday or Friday. Okay? Yeah, next week, Thursday or Friday. Just catch us here, same time. Okay? patapata 11 o'clock, you don't enter studio. Okay? And then we'll talk more. I am doing this for you. All right? So I want you to be in good health and be okay, be fine. All right? Thank you so much. Okay, my brother is here with a good message for us. The message that has to do with property. Owning property is key, is important, is essential, is I won't use.
Hub, which is located in Ekpe. We also have the Lagos New International Airport, which is also very, very close to Ekpe. And we have the Lagos Film City, which is sitting in the heart of Ekpe as well. So if you're thinking about having a property investment, Ekpe is a choice location for you. Now, let me quickly call my phone number. The number to call is 09 299
299
175
5
79
79
090
090
299
299
175
175
79.
79.
Now let me take you to Enugu, where we have, in fact, in Enugu, the Fairview Estate Phase 1, which is located at Udobudo, is now sold out. So, yeah,
okay.
Fairview Estate Udobudo is sold out. We are not like other estate company that when a property is sold out, they will keep selling that property. When a property is sold out in Kudos Homes Limited, we stop selling. So we are announcing today, in case you hear anybody telling you to come and buy land in Fairview Estate Udobudo, the estate is now sold out. We don't have any more land in Fairview Estate Udobudo, but we have in
Tochukwu was saying he wanted to buy. I don't know if he bought.
Tochukwu, no, Tochukwu bought. We have another estate in Enugu. We have in Amokwenike, which is also very, very close to the Enugu International Airport. Now, the Fairview